The research and background carried out through our wider piece of the social prescribing work, which fits under our Workforce Innovation Project, meant we were able to identify 3 key pieces of work. Number 1, to upskill the referral workforce to be able to talk to patients about opportunities to be active in a way which will maximise the chances of them embracing an active lifestyle. Number 2, supporting community-based sports, clubs and facilities to provide a customer-centred and welcoming experience to all new participants. And number 3, to build confidence and trust between the referral workforce and the community provision. Upskilling the social prescribing link workers. So far, 3 Think Active tutors have been trained to deliver the sport and physical activity for the social prescribing training, which was developed by London Sport. We have also delivered 3 courses to 16 social prescribing link workers from 8 different primary care networks. So far, the training has been well received, and we've had a net promoter score of 87.5%. Additionally, the link workers are reporting themselves now at 8 out of 10 in terms of their confidence to start having a conversation around physical activity, using behaviour change techniques and local opportunities to encourage their patients to take part in physical activity. So along the way, we have learnt that including the training as part of the link workers induction means that physical activity can be embedded in their practice from the beginning. It was also easier for the link workers to attend a whole day's training as they hadn't been allocated caseloads at that point in time. We thought it might be difficult for workers to block out a full day, but thankfully this hasn't been the case so far. However, for us as deliverers, planning a course is time consuming in terms of arranging a suitable date, booking a venue and tailoring the presentation, as each course is bespoke to the locality in which the link workers are operating. The training also includes a follow-up half-day session 3 months after the initial training, and getting the link workers to commit to this is more difficult as they have a full caseload by this time. And we are therefore planning to incorporate this into an existing team meeting for future cohorts rather than a standalone follow-on session. We've also found that interacting with social prescribing link workers little and often is more effective, as it helps reinforce the message without taking up so much of their time. A challenge that we didn't anticipate was the staff turnover. So workers who attended the initial training have already left, which means that we then have to arrange training for the new link workers. We've also found that the link workers are working in the first instance with patients with the most complex needs, and so physical activity isn't always something that is initially considered. However, we are hoping that by being in regular contact and offering support to the link workers, they will become more confident to use physical activity at the appropriate point in that patient's journey. For example, in a second or third appointment, once patients' most critical needs, such as food or housing, have already been met. Supporting clubs to be customer-centred and welcoming clubs. In partnership with our local sports development officers, we have developed an online club toolkit for clubs to find the answers to a wide range of general club inquiries and frequently asked questions which they would normally contact their local authority or Think Active about. The aim of this is to reduce the number of general club inquiries that local authorities and Think Active are required to respond to, so that we can prioritise one-to-one club support to those clubs, groups and facilities involved in our social prescribing work. The online club toolkit was launched at the end of January, and so far it has had 65 views, with 32 via Facebook, 25 via direct link and 8 through Google. This toolkit will continually be reviewed and updated to ensure it is kept relevant. Think Active will also be working with the SDO Network to ensure it is promoted as widely as possible. For the social prescribing project, we've been working with local SDOs to identify a small number of clubs, groups and facilities in each PCN area who we felt could cater for inactive people and beginners. We want to test this approach with a wide range of different types of groups, clubs and facilities. For example, everyone active leisure centres, walking sports, walking for house schemes, bowls clubs, physical activity sessions that are held at community centres and also at sports clubs. So far, over 50 different providers have engaged within this project. We have trained and supported the SDO Network to work with their local providers to provide a welcoming and supportive environment for new participants. As a result, the SDOs, on average, currently rate their confidence to be able to support providers within this project as 8 out of 10. Due to the ageing population and mental health hotspot in Warwickshire, we have a particular focus on supporting clubs, groups and facilities to work towards becoming dementia friendly and more confident around supporting people with mental health difficulties. So far, 24 dementia friend sessions have been delivered in local sport facilities, clubs and sports centres, resulting in over 190 dementia friends. Through these sessions, sport facilities, clubs and groups are starting to understand better how they can support people living with dementia to continue to take part in activity. So for an example, John, who is a local golf club member living with dementia, John's friends and family now understand the need to remind John to bring his clubs off the course as he was prone to leaving them. Within leisure centres, locker saddles have been introduced to help people identify their locker easily. Additionally, all staff are encouraged to wear dementia friend pin badges. Also, leaflets were designed and printed promoting centres as welcoming to people living with dementia and also to their carers, specifically highlighting appropriate activities. Staff has supported a customer to continue to swim by pairing that customer with another regular after realising that individual struggled with the swimming circuit. New mats have also been replaced, so there was black mats that have now been replaced following a customer journey review. Staff have also identified changes to narrow and heavy doors to help access as part of a centre refurbishment. So Think Active has also created a dementia-friendly commitment. So we have also been working with It Takes Balls to Talk to develop the support through sport and mental health commitment. By signing up to either of these commitments, the clubs, groups and facilities agree to develop an action plan to work towards becoming either more dementia friendly or mental health confident. In return, these groups and clubs will receive training and resources to help them with this. So far, 2 local sports development officers have trained as dementia champions. Therefore, they can now support clubs in their area. Additionally, Everyone Active also have their own dementia champion to deliver in-house dementia sessions, and they also include awareness training within all staff inductions. We have also been working with the Alzheimer's Society to identify other dementia champions who would be willing to support local sports and physical activities providers to sign up to the commitment and develop their dementia-friendly action plan. There are therefore 15 dementia champions who are able to support sports clubs, groups and facilities across Warwickshire to work towards a dementia-friendly commitment. Additionally, we are working with the SDO Network on how we can promote these commitments throughout 2020 and have developed profiles for the dementia champions as part of these promotions. So through our work with community-based sports and physical activity clubs, groups and facilities, we have learnt quite a few things. So within this, we have learnt that this work takes time. It's important to form a relationship with providers and build trust. So respecting that many of the people we are working with are volunteers as well. We have found that we need to respond quickly to them and be flexible when we arrange meetings, as they usually want to meet in the evenings and on club nights. It is key to get across benefits to clubs and how it will support them. We found it easier to work with larger organisations, including Everyone Active leisure centres, rather than the community provision initially. We've also learned that clubs have wanted to be kept up to date with the progress of the project and when they are expected to have referral patients come through. Therefore, we need to make sure that we are able to manage the club's expectations and explain that they will not likely see an influx in new participants, but is more likely to be a trickle. Building links between social prescribers and clubs. So the SDOs have been invited along to the social prescribing training so that they can be introduced to the link workers in the aim to build a relationship. The social prescribers can then liaise with the local SDOs to let them know what kind of activities are in demand in their areas, so that the SDOs can identify and contact local clubs. This also gave the SDOs the opportunity to keep the social prescriber updated with sports club checklists and the infographics. When visiting and engaging with clubs, the majority of them have asked to meet the social prescriber link workers. Therefore, Think Active have been encouraging social prescribers to go out and visit clubs so that they can see the sessions in action to help bring to life what is going on in those sessions, to give them more confidence when signposting their patients to the session. Okay, so what we've actually learnt from this is, due to the capacity and the time, the social prescribers have found it quite difficult to get out and visit all of the clubs. Therefore, moving forward, we are going to look at facilitating this maybe through networking events instead. The extent of the relationship between the SDOs and social prescribers vary depending on the individual. So one SDO has been in regular contact with the social prescriber in their area and are working well together, and one has met theirs once and hasn't been in contact since. Because of this, moving forward, we may need to work with the SDOs to ensure regular communications with the link workers.